scenario-based question or situational-based question. This type of question, it is best to answer it with STAR method of answering interview question. That is star. S stand for situation. You have to explain what the situations are. What is the situation on ground? T stand for task. What task was assigned to you, or what task did you carry out as regards to the situation? Now A stands for action. What was your actions? What did you do? And the last one, which is R, stands for result. What was the result of what you did? What was the result of your action as a result of the task you did concerning the situation on ground? Okay? So, situational based question or scenario based question is best to answer using star method. So, but do not put star in your head. No, just know that when you start telling them a story, with that story you are telling, for example, let me answer this question. Describe a time you had to deal with a difficult patient or family member. This question they used to attach family member, such that if you have not had any hard time dealing with a patient, maybe you have had hard time dealing with a family member. So then describe it that time for them. Now, in the care home, I've got a resident who one day was banging on the lift. She packed all her bags, was banging on the lift, saying, "They kidnapped me. I want to go home." He was shouting, banging on the doors, on the lift, on the windows. Now, this is a situation, which is S, task. What did I do? Or what was I assigned to do? What I should do is to do something to calm them down. That is the task. I have to find a way to calm them down. That is the task I have to do. Now my action is I walked up to the resident and I asked her what was the problem. She said she has been kidnapped. She said she wants to go home. She said she's tired of staying here. I listened to what she said and I offered help. What did I do? I said to her, "Okay, you want to go home? Can we have a cup of tea or a cup of coffee, whichever one you want? Let's just have it for a few minutes while we get ready to go home." Of course, this resident have got dementia, so I don't know what triggered him or her that they want to go home at that point in time. So I have to find a way to redirect their attention, this resident attention. When I offered cup of tea, two sugar, or cup of coffee, tea, two sugar, they opted for a cup of coffee. I made a cup of coffee for her. I made a cup of tea for myself. We walked to the dining, we sat down, we had our drink. As we are having our drink, we were discussing. Before we could finish, she forgot about going home. Now, the result, which is the last one, the outcome of this thing is that the resident finally did what? Calm down, settle down, and forgot about going home. So, if you are answering this question, do not put in your head STAR. Like, no, once you are saying it, you're already describing this type of method of answering interview questions. Now, the next one I have here is can you tell us about a time you worked effectively as part of a team? Can you tell us? Most can you tell us describe all these things as scenario based question that requires you to paint a scenario for them. Listen, don't say, "Oh, this thing have not happened." You could be asked, I have a question here that said, how would you handle a situation where a patient will refuse care? So how will they know that a patient will refuse care? And they are asking you to tell them how you will handle. So this thing they assume it, so you too have to assume your answer. Put yourself in a situation, "Oh, if this thing happens, how am I going to do this? How am I going to do that?" That is what they are doing. Or do you want to see how prepared you are in your mind if you encounter such problem? So tell us about a time you had to work effectively as part of a team. I could remember, of course, every day we work as a team, but this one is very, very particular to me. we had two of our staff who did not show up for work. They've got emergency. That was a coincidence, and that caused us to be short staffed. While the management was trying to arrange for a cover, we divided ourselves to help each other. I was working on the first unit, so I quickly attend to my resident on the first unit. I went to the second unit to help them because that is where they were supposed to be three staff, but now they are two, and they've got a lot of residents who need um, two assistants of two. I quickly ran to the second floor to help them to attend to some residents, and after that, I helped them to assist some residents to feed before coming back to my unit. So this is me participating actively in a team. So what have you done in your team to say that you have actively, participated in a team? You have to tell them. Another scenario or situational question I have here is, how would you handle a patient refusing care? When a patient is refusing care, what do you do? You don't have to force them. You are never allowed to force them to accept a care. They have the right to refuse if they don't want to. All you have to do is to listen to them, find out why they don't want to. Sometimes they wouldn't have any answer for that. They'll be like, I'm not ready, I'm not ready. If that is the case, then you have to let the person be. But you have to document and come back later. If they're still insisting, you still have to continue documenting. Then your colleague will have to try. You tell another person to try because they are refusing you. Maybe they don't want you to offer that care. That's why they are refusing. Another person will have to try. Maybe that person will be successful. If still the person is not successful, you have to keep documenting it so that the management could offer alternative. Or you go in the morning, they said no. You record it, you go again in the afternoon, going at different intervals. Maybe you might be lucky in one of those times you go to ask. The next one I have here is, what would you do if you notice a colleague behaving inappropriately towards a patient or a resident? Now, if you encounter that your colleague is malhandling or is abusing a resident, what do you do? You have to say, because you see it, you have to communicate. Ask the person, do you know that what you are doing is not right? You don't have to be confrontational about it. You just have to be polite. After that, I will have to report to the right authority following the company um, policy. Must have to follow the company policy to do this report. So I hope this helps you to pass your interview question. Now, in my next video, I'm going to tell us how to answer some numerical, that's little maths. They will say they will test your numerical accuracy and what again? I think the English one. Yeah. So I hope this helps. See you in my next video. If you love what we are doing, please do not forget to like, share, comment, and subscribe.